So today we have Lexi and Amelia from Liverpool Uni, and we're going to be talking about Physio Society at Liverpool. So guys, start off by telling us a bit about you guys, what you do, and something that you do that's non-physio related, like a hobby.
Oh, okay. So I'm Lexi. I'm a third year physio student at Liverpool, and I just like going to the gym. So yeah, that's mine.
I'm Amelia. I'm a third year physio student also. I'm president of the Physio Society this year at Liverpool, and I cook. In fact, I made us tea just then, made carbonara, so I cook.
Ooh, chefing, quite a skill. What's it like being physio president?
It's a lot. It's a lot of work, but it is really rewarding. Like, I do really enjoy it. There's two of us that are present. There's like quite a big society, so the workload is quite equal. But yeah, it's good. It's good to get a lot of people involved and like hopefully like make people want to come to Liverpool.
How big's your course at Liverpool?
Oh God.
I think our year's about 70. But I think gradually as the years have gone on, like I think the year below us is a little bit more, so about 80.
And
then
120 in first year.
Yeah. So
really?
It's big. Yeah.
Yeah. So it's getting bigger as the years go on, I think.
That is so good. We're not that big. We're like 50, 60 in a year.
I think it happened after COVID. Do you know when they gave the grade offers out? They just had to, because they had to honour their offers, they had to bring more students in, but they've employed a lot of staff to help accommodate the more students.
Yeah,
that makes a lot of sense.
They've got like new suites and stuff.
Yeah, they've got like a simulation suite now.
So, yeah.
Wow, that's quite interesting. I didn't know that about Liverpool. I thought it had to be a smaller course for some reason. But anyway, that's awesome.
Yeah.
Whereabouts in the country are you two from? So Lexi, where are you from?
So I'm from the Lake District originally, like right up the top near Keswick.
Right.
So it's quite different going to Liverpool because it's a city, and like I've got the countryside at home, so I quite like the difference.
Yeah.
Personally.
I'm from Liverpool, so
You're from Liverpool.
I'm from Crosby. If anybody knows, it's like the beach in Liverpool.
Yeah.
I'm local.
Nice.
I mean, the Lake District's very beautiful. I've spent quite a lot of time in the Lake District, all around Carlisle and then further south into Windermere and all that kind of area.
Yeah.
Very beautiful. Yeah.
No, it's nice.
Well, I'm like you, Amelia. I'm a London kid in the London Uni.
Yeah.
Gotta represent. So guys, you're on placement at the moment. What wards are you on? Tell us a bit about it.
Yeah, so I'm on women's health, and I'm in Warrington at the minute, which I'm really happy with because that's actually hopefully what I want to do. Granted, this goes well, it doesn't put me off, but I'm really enjoying it at the minute. It's mostly obstetric stuff, but it's fun, good fun. So yeah,
awesome.
I'm on neuro outpatient, so like a lot of like spinal cord injuries that come in for like the rehab. And then I spend 1 day a week on the acute stroke unit in Aintree, so it's a bit of a mix, a bit different, but it's good, really good, really enjoying it.
Wow.
How long are your placements last at Liverpool? So
they're 5 weeks long, but they're only 4 days a week, and then we have a day for study, which tends to be a Monday. But so say like this placement I'm on, I do Monday to Thursday because of their service hours, so it's flexible pretty much.
Yeah. That's pretty standard. Pretty standard, yeah.
So just a quick question on women's health. How's that? Like, it's quite a small specialty area compared to like.
Yeah, I think so. I mean, like I want to do it, so like I might have a bit of a biased opinion, but yeah, it's quite good. So the main one sort of that like I see and that my educator sees, so she's like a band 5, hopefully band 6 soon, but that's like, so that's more obstetrics, that's pelvic girdle pain, that's the most common one. But then you also get some drams where your abdomen split after pregnancy, and then there's also some gynecological, you know what I mean? I've not actually seen any of them yet because we only started last week, but hopefully I'll see some this week. Obviously I can't really do anything because I'm not qualified for that, but it'll be interesting to sort of observe and have a look at. So yeah.
And how did you know you wanted to do women's health? Like, why not something else, or what made you think women's health?
I don't know. We actually only had like one lecture on it. But it was like a really good physio that did it. Like she's
so passionate.
She's very passionate about it and very, very knowledgeable and sort of, but taught in a way that was quite easy to understand. And I guess sort of like I went through the thing, to be fair, I probably wanted to specialize in everything at some point, like except respiratory, that's the only thing that is a no. But yeah, and then like I don't know, I'm just like, I'm not very shy about that stuff.
No, very, yeah.
So I thought like, oh well, I'd be quite like good at that because I'm just quite straight to the point with it, and I'm like, this is the issue we have, so you know, there's no need to be embarrassed about it. So yeah, so, and I also think like as well, like women's health in general, the part that like sort of annoys me a bit is there's potentially less funding in that than other sections, and that's sort of why I want to work in it, because you know it needs the people, and it just needs to be a bit more like, it's so beneficial to so many people, like it just needs more words spread about it.
In the process of setting up this podcast, I looked around for some other podcasts, student physio podcasts, that type of thing, and I came across a Physio Matters, which is quite a big one, and then they have a women's health series on that called At Your Cervix.
I've heard that.
Which I've listened to a few of those, and it's quite good. It's for me as a man, it's a bit more eye-opening, I guess. So it kind of gives me a bit more of an insight. But you know, pelvic health generally is, you know, affects the whole population. It's one of those things that we you know, we take for granted, I guess, our pelvis, don't we?
Definitely. No, that's the thing. Like, I think a lot of people, because like there's a lot about incontinence in it, and like especially after childbirth, people just think that like, you know, leaking's normal, and it's like it's really not.
Exactly.
Exactly. So just, you know, sort of like a lot of, to be fair, before I went uni, I didn't even know like women's health physio was a thing, or like pelvic health physio was a thing. So like especially like sort of spreading the word about it, making people aware that it is a thing and can help a lot of people. I think it's definitely
for sure
going forward.
I was quite cheeky. I actually wrote about women's health and stuff like that for physio in my my UCAS and my interview. I talked about it a lot, but I had really no clue about it. I just kind of knew about it from charity work that I've been involved in, but I just used it as a string to be like, oh, I'm niche. It worked. Moving on swiftly, Amelia, what about neuro? How's your placement?
I love it. I just love physio in general. So, but I love the neuro placement. I like rehab. Rehab's more my cup of tea. So I like seeing a lot. I like to talk to patients. So I like being able to chat to them and like ask them how their days go and things like that. It's really interesting. You see a lot of complex conditions. Like I'd done OSK outpatients before this, and obviously when you see anything that's like any sort of alarming, like if you get any sort of things you think aren't right, you just refer them on. And now I'm starting to see those patients once they've had like, when they've got myelopathy and they've had their decompressions, and then I start seeing them in clinic, and I'm like, wow, like it's really, really interesting. They're very complex, but it's more like when you read it, you think, oh God, I don't know what I'm going to do, but like you just treat the symptoms. So it's a bit overwhelming, but I absolutely love it. Like I like neuro, I like rehab. So it's just like a lot of early stage rehab, which I'm not really used to, and it's just getting like the basics, like the balance and things like that. It's really, really interesting.
It's so nice to hear you guys so passionate about your kind of your areas that you know you like. I don't think it's that common for people so early to know. I think I remember speaking to physios on rotation after they qualified, and some of them were still like, oh, you know, I don't know, I like a bit of everything. But it's so good that you guys kind of have an idea of what you want to do. Like it makes it so much easier.
Probably the only two physios on the course that are like passionate about one thing. Like I'm really passionate about amputee rehab, and Lexi's on it with the women's health. You probably picked the best two to talk about passionate about physio.
Perfect. Oh gosh, maybe it's just meant to be. So about placement, what's a good story that you thought from women's health placement or your neuro placement, or it could be another placement you've got that you just think like, wow, this was so rewarding, like this is one of my top moments?
So mine actually, it's not from placement, it's from work experience I did before physio, but this was like, it was whilst I was applying, and I know like work experience is a bit harder to get now, especially with COVID. So I went up to Glasgow and I went to like a neuro rehab place, and it was just this one woman. She'd had a stroke, couldn't communicate or anything. We were doing stuff with her on the parallel bars, and like it was the fact that she couldn't speak or anything, but like whenever I said something to her, she just gave me like a little smile, and I was like, yeah, like this is what I want to do. Like it was so sweet. So yeah, so I'd say like that was like my moment. Just this lady smiling at me, I was like, yeah, that's what I want to do.
That's so heartwarming. Oh my
I know,
gosh.
it's really cute.
I've had a good few. I think the top one is I did my elective in Alder Hey in hydro and rheumatology, and I was on my hydro part of the day, and a lot of kids that come into hydro have cerebral palsy, and I've had like the SDRs and the multi-level surgeries, and there was this little girl come in, and she was so nervous and she didn't want to get in the water or anything, and we got in the water, and like obviously they just had these really major surgeries, there's not too much you can do. And so we call it swishing, and they lay back and they lay on your shoulder and you swish them in the water just to get like a bit of hip abduction, things like that. And I was thinking, oh God, I don't know what I'm going to do. And she was just chatting away. Like kids are fab, like they just chat to you. You don't have to think of any conversation. They just start chatting away.
Yeah.
It was brilliant. I was like, oh fab, don't have to think of anything. And I think we were talking about Emmerdale. She was like 6. We were talking about Emmerdale. And then my educator goes, oh, do you want to try and walk? I was like, okay. I was like, so we got her on the step, and obviously with water it's a lot easier. So she's about 50% body weight, and we got her on the little step, and she started walking, and she had her feet flat on the floor, and she'd never been able to do that before. Like she's quite a high the cerebral palsy classification. She was quite high, and there was like they didn't really think she'd be able to walk again, and she started walking, and then mum started crying, and then I started crying because I'm a very emotional person, and I was crying. She was just walking, she was made up, and then she started playing basketball, and it just made me realize how much I actually love it, like seeing people get back to where they want to be. And after that I was like, oh, I'm done. This is exactly what I want to do. And it was so rewarding. I'm a very emotional person, but it was amazing. And I think after that there's just always times in like each placement where you realise, wow, like there was a reason I'm doing this. And sometimes some days are a bit, God, I don't know why I do this anymore, but then you have those moments you're like, wow.
Yeah, for sure. I had a patient similar to that, but kind of not similar. He was a stroke patient, and he was kind of on the older side, and he was a post-army guy. So he was really chill. He was so funny. He was very like witty. And so I had him on my placement in the neuro ward. And I remember because our first placement's only 4 weeks, like in hospital, but we do a week before that's kind of online skills stuff. So on my last week, I was like, oh yeah, well, come on, this is my last week, let's do this and let's do that. Let's achieve what we wanted to do and what we set out for. And then it gets to my last day and he goes, Sophie, you're leaving today? And I was like, I know, it's my last day. And he goes, yeah, what am I going to do without you? And I was thinking, keep walking, because we had worked so hard, and he managed to do 2 laps of the ward, and when we started he could barely go to the bathroom, and you're just like, this is so cool. And when you really make that connection with a patient, it's so nice.
100%, definitely.
Yeah, gosh, it's so good that we all like what we do.
I know.
I feel like it's so easy to take that for granted. Oh gosh. Anyway, so what about the course on less the placement side but more of the academic? What are your modules like? How's it done? Are there any super amazing lecturers, or just tell us?
I mean, to be fair, I like all the lecturers.
Yeah, we've got a pretty good bunch of lecturers.
Yeah. So our course is sort of I'd say it's like split almost 50-50. The first year and a half you do pure modules, and it suits some people, it doesn't suit others. I personally quite like it because it means all your exams are done by the first part of second year, then you have no more exams, it's all assignments. And also like when it comes to applying for interviews and stuff, and like
you haven't got to think
for jobs, you don't have to think as far back and be like, oh, like I've done this 3 years ago. So I quite like that. So first year it's like you've got your upper body and lower body anatomy. You've got, like, they call it core skills, that's like sort of your manual
crutches, walking aids, all that business.
And then you've got research, which is like just giving you research skills, and looking into sort of that side of physio, which, to be fair, I don't think I really realised until I got into uni. I was like, oh, I'm still doing research, but yeah. And then you've got personal and professional development, which you've got one of the PPD modules like each year. You've got 3 disciplines in second year, so MSK, cardio, neuro, do exams and all them. You have research again, you've got PPD again.
And you've got specialist.
Yeah.
which is like which is where Lexi learned about women's health and became really passionate about that. Amputee, peds, what other bits?
Sort of like your extra sort
elderly
of
care
ones that you have, I guess. So,
yeah.
And then this year, so we've got research with our dissertation.
Woo.
And then sort of clinical, I think it's called clinical physio, something like that. It's basically like specialist again. It's sort of like little bits and like a bit more about the laws and stuff, I guess. And
context.
That's it. Context. Not clinical. And then you've got your PPD again, which sort of that's quite good because our assignment in that is a portfolio basically. So then it gets you ready to apply for a job.
So you guys are very busy.
Yeah.
Do you guys know what you're going to do your dissertations on? Have you got any ideas?
Oh,
yeah. I can never word mine right, but like I think we both. Yours is really good.
I've known what I was doing since before I came to uni. You, on the other hand,
I had. You know what? I have had a nightmare choosing my disc question. Like I feel like I've done that typical uni student thing of like you go to find one thing and then like for whatever reason that doesn't work and then you find another and then you find another and all this kind of stuff. Mine's changed like 5 times, but
more than that
probably. But I have my one that I'm actually doing it on now. So mine's on acupuncture as a way of improving quality of life in women who are experiencing menopause symptoms as a result of chemotherapy from breast cancer. Oh no.
Early onset menopause.
That is good.
Yeah. So I actually got it off of my hands therapy placement because I spoke to an oncology physio whilst I was there and he was like, yeah, use acupuncture for breast cancer. There's medications that help with menopause that some women take, but it's contraindication if you've had breast cancer. And then the anti-estrogens that people take gives them like menopause symptoms. So, you know, if you've had somebody in their 20s who's had breast cancer, they're then having to take this anti-estrogen medication, and they're then on top of, you know, having been through that traumatic experience, they're then also having menopause symptoms too on top of that. So it's sort of finding a way to sort of limit that a bit.
That is so
good. So hopefully I execute it well.
That will go well whatever it happens. Yeah, that'll be amazing. I'll have to message you when you release that.
If it's released.
It will.
Yeah.
Well, I'll have to hit you up whenever you finished it. Just pick your brain about that because that is interesting. What about you, Amelia?
Mine is on so I love amputee rehab and I have since before I started uni, and I 3D printed a prosthetic. I think that's the only reason I got into this course was because of the 3D printed prosthetic. But mine's on gait rehabilitation in non-vascular amputees and their effects on energy expenditure. So I've done a lot of I've seen a lot of military patients. Went down to the DMRC, saw a bit of that, and I was like fascinated by it. And then there's a lot of research into vascular patients, so like PVD and things like that, like all of those causes. But there's more available research into like trauma amputees, so like road traffic accidents, like through like war, things like that, like bone cancer and things like that. So I found that really interesting, and I thought, what can I do on that? I love gait rehab, I love gait analysis, so I'll put that in. And then energy expenditure, because it's such a barrier to rehab, like fatigue, and a lot of amputees experience that to a higher degree. So because they've lost a limb, like they have a higher higher energy expenditures. They expend more energy, they expend more calories, they get fatigued quicker. It just takes there's a lot of trauma that's gone into the body, so it takes a lot to get used to. So I just found that really interesting, and I prefer like end stage rehab with like amputees. I just find it's a lot more interesting, like pushing people to their max, and I think it's just really something I'm really interested in. And so I'm doing a systematic review, which I'm not sure whether that's a good idea anymore. But
you're the only person in the year, aren't you?
Yeah, there's 2 of us. Two of us doing a systematic review, but I'm not very good at research proposals, so it was one or the other, and that's what mine's on. But
guys, that is so exciting. I'm so excited for you. That's like 2 of my favourite topics, just together but not together, you know what I mean? That's awesome.
Obviously you guys in your 3rd year, so how did the bulk of the COVID situation impact you guys?
Oh, quite massively.
Yeah. So yeah, it was all online, and then the practical stuff we got put into really small groups. So it's like groups of about 12
We were together, weren't
people.
we?
We were together, but then you got put in threes, and usually like they'd encourage mixing with different people in practicals, but obviously because of COVID they were like, no, you can't do that, so you got put in the same three for the whole year.
For the whole year.
For the
Yeah,
whole year,
even for the first years, that I can imagine that was pretty hard for them.
Yeah.
Not meeting anyone new.
Yeah, I mean, it probably helped with some of the exams. So I had to resit my anatomy exam in first year.
So I had to do my core skills.
Yeah, so we did have to resit, but because they couldn't put all the content in it because it was online, it possibly made the exams a bit easier and worked in our favour. Luckily. So yeah, and yeah, it was just like all the exams were online. All the teaching mostly it was over Microsoft Teams. We were quite lucky though, because so a lot of our modules were taught, it's like called problem-based learning. So they give you like a scenario and then you discuss it as a team and like go through different learning objectives through that. And like you could do it quite well on the computer, luckily. So I don't think that was actually changed
that was okay,
too much.
yeah.
It was just instead of writing on a whiteboard, you'd be typing.
We'd finished most of our anatomy. We only missed, I think, like the neck. So we didn't really have the limitations of that. And I think that's become more apparent with the second years that are second years now, because they didn't get to do their anatomy in person, but thankfully it's all gone back to normal.
Yeah.
But I think they struggled a lot. And with the socialising, that's something we had to do a lot with. Like I was netball captain last year for the physio netball, and I think we've never had so many of them because they just didn't socialise with anyone.
Yeah, that's right.
So we had like 100 girls playing netball with like COVID restrictions, because they've not seen anyone all year. So it was a lot.
Even I went and I didn't even have an interest in netball. I'm shocking.
So yeah, like we don't know physio outside of COVID other than what we've like experienced. So I'm not risk assessed to see COVID patients because I've got really bad asthma and I've got a terrible immune system. So I can't see any COVID patients, but on my ward there is COVID patients. So I think that's a bit tricky because you have to have your fit tested and your visor on and everything. But you were on a COVID ward.
I was so my placement before Women's Health, I was on COVID ward. So that was like a lot of patients on CPAP and stuff.
Are there any smaller universities around Liverpool that feed into the hospitals?
Loads.
So we have most of the Liverpool sites, so like Alder Hey, Aintree, the Royal, they're like they're mostly ours. But then as I say, so like I'm in Warrington and I'm pretty sure Manmet and maybe
in Aintree and the Royal as well.
And then there's Salford, I think, feed into a couple as well, and then I also think Chester.
I think because of the shortage, unis have been like they're going further afield.
Those are you last one.
So we're the uni in Liverpool that do physio. Obviously there's a lot of there's like nursing, occupational therapy, there's loads of students. Like on my placement right now in the wards, when I go into the wards, I think there's about 5 students, and it's not big enough of a team to have 5 students. But it's just the unis are starting to
it's problem solving, I think.
But there's man-met students in all of ours pretty much now. There's a lot in Alder Hey. I feel bad for them commuting from Manchester, to be honest, but
I bet.
It's we have a lot of students in Liverpool, but we're quite lucky that most of our placements, the furthest we'll go is Southport, which is a 2-hour commute on the train. Which isn't great. My housemate had it, the placement just gone, but they do tend to give those placements to people that live nearby. So mostly stay pretty much on the Wirral or in Liverpool generally.
There's another thing that they're bringing out, which is like a paired up placement almost. In my last placement I was on the COVID ward, I was actually with another student, so we'd go around as a pair and stuff, and like that was quite nice. Actually, I actually really enjoyed it. I got on with her, and as my educator said, she was like, she liked it. But then she was like, the only issue would be if you didn't get on with your pair, but luckily she's not had that happen yet. But it's quite nice because you can like bounce off each other, and I think as well, like if you've got someone who's more confident and someone who's less confident, like you can give each other confidence and doing stuff, and like even just discussing something with another person, it really helps
you understand it better as well, doesn't it? If you're bouncing off someone, even if you understand it slightly better, you can Yeah.
100%. So I think that's definitely, like, if anyone, like, big boss is listening to this, like, that would really
We all
that's
love
a really good
having
idea.
someone with us, especially at lunch when you're sat, it's the first lunch, you don't really know anyone, at least you have someone to talk to, so it's not as awkward.
Yeah, they can't really leave you, can they? Because you
Yeah,
can
exactly.
It's a bit awkward, doesn't it?
Yeah.
Yeah, gosh, it sounds very competitive. If I was with a partner, I would just, my competitive instincts would just kick in. It would be like, even if it was like my best mate, I would still be like, right, you got that answer right, I've got to get the next one. Yeah. So final question, guys. What is your golden nugget moment? What is something that you wish you could tell a younger physio student, or you could tell yourself?
So mine's like, I don't know whether it's golden nugget moment or not, but basically one of the students, and they're saying, whilst you're applying, like, just NHS core values, like, whack them in your application, and, like, sort of be like, oh yeah, so you're, like, caring, you're compassionate, tell me how you're caring and compassionate.
That's so true. Because sometimes you just whack them in and no one says why. If you say why, if you give an example, even if it's just an example of two of them, they love it.
Yeah, definitely. And, like, all the unis I applied for, like, core values were, like, a big thing in the interview, so definitely that. And then also, like even if you can't get work experience in a place like it, just show that, like, you know, that physio is not just sort of your sports injuries and stuff that everyone thinks it is. There is different aspects to it. There's, like, respiratory, there's women's health, like you've got like showing a wider knowledge, I guess, of what it is, and that you've really researched it and you know what you're getting into, sort of thing, I'd say.
Yes, definitely research it. That is a good idea.
Yeah, 100%.
I think mine would be is that when you go out on placement, you might not love some of your placements. And I know a lot of people, like, they'll go into their second year and they'll get some placements that they're not a big fan of. I think sometimes it does take you time to find what your passion is within physio. And I think people go out and they get disheartened when they've got, like, community or something. Like, if you go into placement, like, I personally don't really like community, wasn't my thing, but if you go into it with an open mind and you take every opportunity that you can from that placement, it will become 10 times better. Like, even if it's the worst placement on earth, all you're doing is getting people out of bed and putting them back in bed, like, it's not, that's just one placement. There's loads of other opportunities. I think if you just take everything you can from it, rather than just thinking, I hate it, then it will get better and you will enjoy it more. And just think, like, everyone gets a good few placements. Like, I've been really lucky, I've loved all of mine, but I think some people, like, you just gotta think with a positive, go in with a positive mind, don't go in dreading it. It's like, one of mine. Because I used to do that, and then someone told me to stop doing that, and it got better.
Those are very wise words. No, I can so relate to that. The community and having placements that you're not too keen on. I am terrified of my cardio respiration placement. That is going to be a baptism of fire, because that's going to really make me learn everything.
That was like me. I was like, what is going on?
Patients.
I'm going to be like, oh my god, what? I'm going to be so scared. I'm going to have to really up my game for that. But anyway, Damien's laughing because he knows it's true. We're practical partners, and it's a nightmare when it's
cardio is scary. Cardio is like, oh, this patient's going to faint on me because they stood up.
Literally,
like, what do I do?
I haven't done any cardio yet. In fact, Lexi borrowed my stethoscope for my last one. I haven't done any cardio. And the thought of, like,
it's all right. It's fine.
It's just a lot. It's overwhelming, isn't it? But I think you're never left to your own devices.
Once you get into it, it's like the same with all patients or placements. Once you get into them, you're fine. Like, it's just the
initial stages of getting over there.
Yeah. I've never listened to a chest before, and I'm a third year. I've never done any suction or listening to chest.
Nor have I.
I just learn when you're there, don't you? You just like, I was in my MSK piece when I straight up said to my educator, I was like, I have no idea what's going on. I don't know what I'm doing. You need to treat me like I know nothing. And I came out of it and I loved it. So
yeah.
Okay, note to self: tell them you don't know anything before you start.
Yeah,
and they'll come out loving it.
It can only go up from there.
If we set the expectations low,
exactly, low bar.
That is the overall golden nugget for everybody listening. Set the expectation low, and you can only go up.
Exactly. Yeah, it's definitely.
Probably not the best one to give, but it works. So, guys, thank you so much for taking time to chat to us about physio at Liverpool and answer all our many questions. Thank you so much.
Thanks for having us.
Nice to meet you.